Do you agree with the theory, and this is one of the theories out there, economic theory, or based on that, that in lowering the taxes, that puts more money into the consumer's hand, into the business's hand, and therefore they get to purchase more, and therefore the revenue comes to the state off of those higher sales, other products being bought, made, manufactured, and so forth?
It's as simple as looking at the choice of how you slice up one pie or whether you're going to make more pies. Because if you all you're worried about is how much money I can take away from a fixed amount of money that the consumers have, that the voters have, versus can I find a way for them to have more money and then take
a small part of each of those two pies instead of a large part of one pie.
A continually greater portion of that single one, yes.
Okay.
That's, in a nutshell, that's what it is. If we tax you $100 and it goes to the state, most of that money is wasted. It gets ground up in the mechanism of government on its way to wherever it was supposed to.
Going through the bureaucracy.
Yeah.
You're saying.
Right.
Okay.
Before 15 cents of it finally reaches, or when I start with $100, $15 of it reaches its final destination. But if you take that $100 and you go, down to the local furniture store and you buy a lamp and whatever, then the person who owns the store then takes the $100 and he pays for the lamp, but now he's got $40 that he goes out to eat dinner with. And then the restaurant owner and the waitress, they take that and they go down to the grocery store and they buy their groceries and so on, and the money keeps moving through the economy. And that's where it's called the multiplier effect. That's what we don't see. When the government reaches in, grabs that $100 from you to start with, all those other people down the line never get to see it. The restaurant owner, the lamp shop owner, the
grocery store, the farmer.
They never got the money. I mean, because the government grabbed it first.
Because that's one of the best explanations of the multiplier effect I've heard from economists in quite some time.
Well, the great thing about my position is being both trained in economics and then, on the other hand, having owned a business.
Real world economics.
You got both sides of the coin, and you understand the theory and you understand the practical side of it. Unfortunately, most of our lawmakers have never done either. They've neither studied economics or actually done anything in the real world.
Facts.
Okay,
for a moment.
Go ahead.
Stepping away from economics, and there are other issues. We were talking a little bit about healthcare.
Right.
And healthcare, and if we're going to speak about healthcare at all, we have to bring up the subject of the healthcare reform. Across the nation, some 56% of the population want to have the healthcare reform repealed. And before it was passed, some 62% of the nation didn't want it passed.
Right.
It was pushed through by Congress, middle of the night almost, without anyone really knowing what was said. Matter of fact, Speaker Nancy Pelosi mentioned, we'll learn what's in it after it's passed.
That's true.
Well, we're learning what's in it now that it's passed. And even though it's a national issue, let me ask you, what is your opinion, both as a business owner, as an individual, and as a potential assemblyman for New York?
I agree with the majority of people in America that we should not have passed that bill. Many of the major concerns with why our healthcare system is not functioning the way it should weren't addressed at all. A typical example, a big example, is tort reform. We all know, speaking with any medical doctor, that they have to try to prevent lawsuits. Rather than practicing medicine, they're practicing preventing a patient from suing them.
Litigation. They're trying to avoid the litigation.
So they end up ordering tests that may not be needed. They end up doing procedures that their judgment wouldn't indicate they'd have to do, but they're doing it to protect themselves. Obviously, this drives medical costs up fantastically. The cost of malpractice insurance there are towns in this country that don't have an OB/GYN because of the malpractice insurance. None of that is addressed in the Medical Reform Act.
Right.
There were tremendous mandates on employers put into the act. There were restrictions on doctors put into the act, on hospitals, on healthcare workers. You know, all in all, it was a mess. And I would, fortunately, I'm not going to Congress at all. But
for your part, you would support.
I would repeal it yeah, absolutely.
That I want to also make clear. Are you in favor of true reform, or a better reform, or more comprehensive reform of healthcare that does cover the things you're mentioning?
Those things need to be addressed. Absolutely. One of the things, again, from an economist's point of view, is whenever you interject a third party into a payment system, you lose the basic. You go to the doctor is charging your insurance, the doctor prescribes you 2 aspirin and charges the insurance company $20 for the 2 aspirin.
Right.
You are not paying for it, so you're not, pitching the fit that if he had charged you $20 for the 2 aspirin.
That would be a whole different argument.
And that's what happens whenever we put a third party into paying things. There should be incentives for us to make sure that we're getting health care at a reasonable rate. What we're receiving is what we should. So you're not jumping in the ambulance to go down to the hospital because you got a hangnail. If you're not paying for it, it doesn't matter to you.
Right. So it's abusive. You're going to abuse the system because it's free.
Exactly.
Okay.
So we need incentives for people to actually do what's right and save the system money rather than abusing it. The medical savings plan has been around for a long time, and it makes a lot of sense, where you're, instead of contributing these large amounts to healthcare premiums, you buy a policy that covers the catastrophes, the things we really worry about in life.
A heart attack, a major accident,
cancer, whatever.
Yeah.
So, and instead, you take the difference and you put it into a savings account that's dedicated for medical needs. So if you don't spend it, you get to keep it. So you cut your own nails instead of going to the doctor for it. You schedule regular checkups instead of taking the ambulance to the emergency room. Those things are a lot less expensive. You're paying for them out of your savings account, so you're watching what the costs are. The $20 aspirin you're going to scream about because it's coming out of that savings account.
Which helps bring the cost down.
Yeah.
More realistic.
That's right.
It's more realistic. Okay. Go a little bit closer to home, something a little more local. Right now, I'm sure you've heard about this. I think almost everyone in New York State has. And almost everyone has an opinion, except the elected officials right now. With the only two who have actually said anything are Governor David Paterson and Mayor Bloomberg.
Okay.
Actually, there's 2 issues. I'm going to